Welcome to the Wellness Protocol, your source for guidance on metabolic health, hormones, and longevity. I'm Dr. Alessia Roehnelt, double board certified endocrinologist, and on each episode, I'll share simple tools rooted in science and experience to help you feel better, live longer, and take control of your health. Welcome back to the Wellness Protocol, your trusted source for practical insights on metabolic health, hormones, and longevity. I'm Dr. Alessia Roehnelt, and today we're diving deep into a topic that impacts nearly every woman at some point, and that is perimenopause. If you found yourself feeling exhausted, experiencing mood swings, having unpredictable periods, or simply feeling like you are just not yourself, you are in the right place. Perimenopause is real, common, and oftentimes confusing. But here's the good news. You don't have to navigate this alone. Today, I'm going to break down exactly what perimenopause is, when and why it happens, the signs you should look out for, and most importantly, practical tools to help you feel better right away. So what is perimenopause and when does it start? Well, perimenopause can start about 10 years before someone goes through menopause. And the average age of menopause is anywhere between 45 to 55. That means that you could technically start to develop symptoms of perimenopause by age 35. The difference between menopause and perimenopause is actually whether or not you're getting a menstrual cycle. Menopause is defined as not having a menstrual cycle for a year or longer. Other than that, so what are the most common symptoms that people start to get during this period of life? In my practice, I find the biggest one that starts early is an increase in anxiety. I've had patients come in where maybe they had a history of anxiety in the past. They found tools to control it. It was very mild. Now that they're going through perimenopause, it is completely uncontrolled. I have had patients where literally their husband brings them into the office and says, "Fix her. This is not the woman I married," because mood changes are so apparent right in the beginning of the perimenopause state. I've also had women that have never had anxiety in their life, and it's very difficult for them to understand what this feeling is that they've never had before. But many will describe it as feeling completely overwhelmed by everyday tasks, feeling very irritable, lashing out at their family members, yelling at their kids, yelling at their husband, and just having a really short temper. And that is the beginning of perimenopause and the anxiety that comes with it. Another very common sign of perimenopause is sleep disturbances. This means that you may be fine going to bed and fall asleep like usual, but you'll wake up at 2, 3, 4 a.m. unable to go back to sleep. You might wake up with some heart palpitations where your heart is racing. You might wake up feeling very anxious, almost like you had this adrenaline surge that came out of nowhere because you were sleeping, but it's almost impossible for you to get back to sleep. As time goes on, this feeling overnight may even start to turn into having some night sweats, which is where your body starts sweating to the point that you're drenched. You might even have to change your clothes or even change the sheets sometimes. We also see that people can get these hot flashes during the day. So out of nowhere, they have this sensation of this overwhelming heat that kind of comes up from within and goes throughout their body. And that also results in excessive sweating. Another symptom associated with perimenopause is brain fog and trouble finding words. If you ever get that feeling where you walk into a room and you think, "Why did I come in here?" and you have no idea, or if, like me, you give your son a knife to cut his dinner with and you say, "Here, take this piece of paper," and things make absolutely no sense, you're probably in perimenopause. And lastly, the weight gain. Almost every one of my perimenopausal patients comes in where they have gained weight rapidly. They have not changed anything about how they're eating or how much they're exercising, and they're gaining anywhere from 1 to 10 pounds per year because their metabolism is starting to slow down. They will say that they're carrying fat around their belly where they never did before, and it just doesn't feel like they are in their own body. So how can you test to see if somebody is in perimenopause? Well, unfortunately, that's the big problem. There is no one test which can tell us whether or not a woman is in perimenopause. And I often feel that's why it gets dismissed potentially, because there's nothing to say for sure, yes, this is why you're experiencing the symptoms you are. There is not a good test for this. However, if you are having these symptoms and you are in that age range of about 10 years before the average age of menopause, so you are 35 plus, and you see your doctor for a visit and all of your other blood work is normal and there's really nothing else to explain this, well, I can almost say with complete certainty that you are in perimenopause. So why does this happen to our bodies? Well, as I said, there's no good test to say that someone's in perimenopause or not. And that's because when you're in perimenopause, you are still making a relatively appropriate amount of hormones. You are still making estrogen, progesterone, and testosterone. And because you are still making those hormones, you will either be getting a period regularly every month, or maybe every few months, or maybe your periods are getting closer together. But the fact that you are getting a menstrual cycle means that you are still making those hormones. However, those hormones go up and down like a roller coaster. Since you started getting your period when you were younger, you would have an increase in estrogen in the beginning of a cycle, followed by a decrease in estrogen. Then you would have an increase in progesterone, followed by a decrease in progesterone. And your body was okay handling that up and down. However, once you get to the age of perimenopause, your body does not like that roller coaster anymore. The surges in estrogen, the crashes, the heightened progesterone, the crash, you don't feel well with all of these rapid hormonal fluctuations. So one of the reasons why people get symptoms is that their body is just changing how they respond to these hormones. And your body is also changing in terms of its metabolic health. We see that when women are getting close to menopause, that they have increased insulin resistance, which is what starts or causes prediabetes and diabetes. We see a slowing of the metabolism. We potentially see changes in thyroid function. We see changes in cholesterol, in new cardiovascular disease. So there are a lot of changes going on with the body around that period of life that are way past. So there are a lot of changes going on with the body around that period of time that are just wreaking havoc on how you feel. So many patients ask, well, when do I need to call for help? When do I need to do something about this? We talked about how there is no test to say you're in perimenopause. It is more symptom-based. And that really is how we recommend treatment based on symptoms. If you feel like you are having very bad perimenopausal symptoms that are affecting your quality of life, worsening anxiety is contributing to issues with your relationships at home. Perhaps your hot flashes are contributing to issues when you're at work. Perhaps your inability to get a good night's rest is contributing to a poor lifestyle in the day that follows. These are all reasons to look for help. And there are numerous ways that we can help the symptoms of perimenopause. So let's start with each symptom. Number one, weight management. This is huge because for some people, it is really the weight changes that really cause the most emotional distress. We know that the metabolism naturally starts slowing down in the late 30s or early 40s. We also know that if you don't change anything about your routine during those ages, you will slowly gain at least 1 to maybe even 10 pounds per year. And that is just keeping everything the same. So you need to recognize that about your body. Your body is changing. You need to change with it. That means that if you have been doing the same exercise routine for years, you need to change it up. Maybe pull back on the cardio and add a little bit more strength training. Maybe if you do 3 days a week, you bump it to 4. Just adding a little bit extra and changing up the routine can be enough to really get your metabolism going again. Muscle is also incredibly important because your metabolism relies on muscle. The more muscle you have, the faster your metabolism will be. Muscle also helps fight insulin resistance. It helps you process glucose or sugar, and it helps keep you at a healthier weight. So I can't emphasize enough the importance of strength training as you get into that perimenopause age group. Another thing to really prioritize, and I'm sure you've heard this a million times before, but eating protein in your diet. Protein is so important for keeping your energy levels high, maintaining a normal blood sugar, and helping to promote more muscle strength. There are some potential supplements that can help your metabolic health as well, such as omega-3s, potentially magnesium, and those are all things that you can discuss with your doctor to see what kind of individualized plan you may need. Stress management and prioritizing sleep is another thing that is now going to become mandatory. You have to carve out that time for yourself. Otherwise, your symptoms of menopause really could just get worse instead of getting better. Could really affect your metabolism, your ability to concentrate, your ability to handle stress in general. So prioritizing mental health and carving out that time to get a good night's rest is paramount in feeling better. Let's talk about some of the options for treating hot flashes, night sweats, and sleep. There are hormonal options and actually non-hormonal options. Let's talk about the non-hormonal options first. I oftentimes find that when patients come in and they have been told that for whatever reason, hormone replacement therapy is not safe for them, or the patient just doesn't feel comfortable starting hormone replacement therapy, there are still some options. There are certain medications that can either be given during the day to help with hot flashes or even overnight specifically to help with hot flashes. One of the medications that we oftentimes use to help with either daytime hot flashes or very uncontrolled anxiety are medications called SNRIs, like Effexor, or SSRIs, like Lexapro. These medications help to calm down the nervous system in a sense so that you are not having that excessive anxiety or those excessive generations of heat randomly in the middle of the day. Similarly, there is a medication that is actually designed as a nerve pain medication called gabapentin. It has been around for a very long time. Studies have found that gabapentin at certain doses can be very effective at calming down the nervous system so that you are not waking up in a panic in the middle of the night. You're not getting that adrenaline surge for no reason, and you're not having these drenching night sweats. The downside to gabapentin is it can't be used during the day at these doses because it would make you too drowsy. But when given at night, it can actually be a really good option to also help get a good night's sleep. There are other additional medications being studied for treatment of hot flashes. So if you are suffering with these symptoms, talk to your doctor because even if you don't think you'd be a good candidate for hormone replacement, there may be some other options out there. Now let's dive into hormone replacement therapy. Hormone replacement therapy is really becoming more popular. And the reason for that is because we're realizing the safety and the potential health benefits of hormone replacement therapy for perimenopausal or menopausal women. Many studies show that hormone replacement therapy can actually reduce the risk of cardiovascular disease by up to 30%. It potentially can reduce the risk of dementia. We certainly know that it is very protective for bone health. And most importantly, it can really help people feel better. Hormone replacement therapy can really fix all of the symptoms that we discussed. It can help with hot flashes. It can help with night sweats. It can help with the overnight awakenings. It can help with the brain fog. It can help with the anxiety and irritability. One thing, however, I will caution you on is I would not expect that hormone replacement therapy will help your metabolism significantly. Some women actually may gain a little bit of weight when they start estrogen. Some women are weight neutral. Occasionally, I have patients that lose a little bit of weight, but I always caution my patients, don't start this thinking that this is going to make you lose weight. It will help your metabolism so that when you're doing the things like eating your protein and staying hydrated and exercising and lifting those heavy weights, it will help those things to work. But if you don't implement those lifestyle changes, you're not going to see a big shift in the scale. Be given as a topical cream. It can be given as a topical patch that you wear on the skin. It can be given as an oral pill that you take, or it can actually even come in the form of just a birth control pill. And the formulation that you receive is really dependent on what you are looking for, what you are most comfortable with, and what your doctor feels is safest for you. Many patients ask me, well, how long will I continue hormone replacement therapy for? That is a very individualized answer. I have patients that use it for a couple weeks and then they stop because they just don't feel better on it. I have patients that use it for a couple years. I have patients that use it for decades. It really depends on the patient, their medical history, and their symptoms. And that would be a discussion you would have with your individual doctor. Many patients come in to me asking when they should start it. They're having some symptoms. They don't know if they should wait until they lose their period, if they should start it before. Now, while the answer to that really does depend on symptoms, I will say in general, we recommend starting hormone replacement even before you've completely gone without that period for a year. It seems to be a smoother transition for your body to start estrogen while you're still making estrogen. And then we can titrate the dose as needed as you progress through menopause. In upcoming episodes, we are going to dive into the differences between hormone replacement therapy, whether it's bioidentical, compounded, synthetic, estrogen, progesterone, testosterone, and everything in between. But for now, thank you for joining me on this episode of the Wellness Protocol. If this episode resonated with you, please hit that subscribe button and consider sharing it with a friend, a sister, a colleague, anyone that you think could benefit from understanding perimenopause better. Your support really means the world to me, and it helps me reach more women who deserve clear, practical advice on their health. And be sure to follow along for future episodes where we'll explore practical ways to optimize hormones, metabolism, and longevity. And as always, stay curious, be well, and remember, you're in control of your health. Small changes can truly lead to lasting results. See you next time.